40 years ago in 1984, the first person to be diagnosed with AIDS in Edmonton, Alberta was Ross Armstrong. Ross was a competitive swimmer. He also competed in the very first gay Olympics in San Francisco in 1982, which at that time he won a silver medal in his category. This young man unfortunately passed away early 1986 from complications of AIDS. This was the beginning of the rise of the HIV epidemic in the early 1980s. Hello, my name is David Stafford. I'm pleased to have with me today Dr. Barbara Romanowski, who is the director of the AIDS program in Alberta. Welcome, Dr. Romanowski.
Hello, David. Thank you very much for the invitation to participate in this video.
Great to see you. I hope all's going well, and it's been a number of years since we've seen each other.
It has been a number of years. I am enjoying retirement, but I miss seeing people such as you on a regular basis, my other friends and my colleagues, but life goes on.
Good. Yeah, and it's hard to believe 40 years has gone by since the beginning of all this started back in Alberta and throughout the world.
Yeah. It is absolutely amazing. For me personally, when I started my career in infectious disease, HIV had not yet been recognized. That happened, and sadly it happened, but it happened 3 years after I assumed my position as director of the Sexually Transmitted Disease Program. But in the 40 years since then, we have seen such a progression in HIV. As you described, Ross succumbed to this infection very early in its course. Now we have medications that allow people to have essentially a normal lifestyle and normal life expectancy, which is amazing.
Yes, and I would like to go back and talk about a few different things towards the beginning when you started all this. Because first of all, before Edmonton, you took a year, I believe it was 1 year sabbatical to London to learn more about the AIDS. And why was it London when there could have been the States that was closer, things like this? Was there some sort of a better tutor from what's going on in this type of thing?
Actually, the sabbatical was not HIV related. It was a sabbatical to the UK, to London, to do some research on other sexually transmitted diseases. And the reason it was the UK is that I happened to have been born there, lived there until I started school. I had a lot of colleagues in the UK, and there was an opportunity to do a sabbatical in London. While I was on sabbatical, the reports started coming out of Los Angeles of this strange lung infection that was occurring in young gay men. And
Yes.
I mean, from then on, we all know what the history was. So I first became aware of HIV while I was on sabbatical. Shortly after I returned to Edmonton, I saw my first HIV patient.
Yes. Okay. Thank you. Yeah, I wasn't aware of that. Then, but let's just talk a bit about around the first days when more and more patients were starting to get HIV. Once they got it, it was kind of considered a death sentence. That's what they thought. Then they were more or less referred to you. But even at this time, there was very little medications, and my understanding, the medications really didn't cure the disease. Was more or less helped out with the effects of what was happening. So when they came and visited you for their first visits, things like this, I mean, they were totally confused. How did you handle all this?
It was very difficult for both the patient and for healthcare providers, including myself. First drug we had available was Zidovudine or AZT. I remember with the prescription, patients were given an alarm clock because the information we had at that time said the drug had to be taken every 4 hours. And you're absolutely right. It did not cure the infection, but it, to a small degree, in retrospect, maintained their immune system for some period of time.
Yeah. And that, and because even too, they're going in, and the early days, they were walking in, and they had no places to turn, change, and I mean, there was very limited answers they could get from anywhere, and basically, you were the frontline person of all this. That must have been very hard on yourself when that.
It was very difficult. Not only did we not have answers from a medical perspective, but there were all the other issues of no support in the community. A lot of families disowned their children because of this awful disease. There was all this misinformation that it was airborne, that I can't touch you, I can't be close to you.
Yes.
It was unbelievable.
Yes, but even you mentioned, the misinformation, that's kind of misinterpreted. That reminds me of one article I read, and this has to do with actually was a doctor out of the university, and that I won't mention his name. I'll just say Dr. G, and he was doing a forum for teenagers and parents. There's about 200 altogether, parents and teenagers, and he said that it was transmitted through the green monkey. When I read this, I'm thinking, and also in the article, you did kind of respond back to it just at the time, but he was saying that it was spread through bestiality, and that, which was crazy.
But that was sadly, a very common myth at that time, that the first patient had engaged in bestiality in Africa, and somehow it got back to North America. I mean, we knew at that time that that wasn't true. We have a lot more information now about patient zero, but the misinformation also went, sadly, much further. As you referred to an unnamed physician who potentiated this myth. But if individuals with HIV were admitted to hospital, there were signs on the doors in their hospital room saying, "Do not enter, contagion." People wouldn't deliver their food. It was left on the floor with the door closed. They were awful, awful, awful times, and they were difficult for all of us who were trying to educate, trying to provide care for people.
Yeah, and that was another thing too, is that you did bring that up, that because it was very understandable. The healthcare workers, they didn't know much about the disease, a lot, and so they were afraid. But how did that turn around? What type of education were the healthcare providers given to, over the years? I mean, more drugs that came out with things, more understanding of the disease itself. But back at that time, because these poor people weren't getting the treatment and the care that they were supposed to get.
And the short answer, David, is through education, through repeating the same message over and over and over and over again. You educate some healthcare workers who then educate their families, and the correct information gradually spreads. But this didn't happen in months. It took years and years.
Yeah. And yes, it was a really hard time. But that's I think too, that you found that education was something that you had to really get involved in. and that's over the years.
Exactly. Not only education of patients and education of their families, but public education. I did not receive any training in med school on how to do TV interviews, but I did hundreds and hundreds and hundreds of talk shows, of um, media interviews to try to get the correct message out, how this is transmitted, what the consequences are, how one is diagnosed, what is available for treatment.
Yes, but also too, you did a lot of those interviews and things like this, but the media seemed like at times they would take something that you said and turn it around, and that so you had that to deal with too a lot. But how the media was treating you.
That's probably the media's job. They did it then, and they're still doing it.
Yes, yes, big time, and that the for a while there. Also, you got involved with the AIDS Network, did you? And what was your involvement with them?
The AIDS Network is an invaluable community resource. I remember sitting around Michael Fair's kitchen table in 1982. No, sorry, 1984, planning the development of this community resource.
Yes.
They provided education, they provided support for the patient, they provided support for families. They had to change as the epidemic changed, as the risk groups changed.
Yes.
But they are a marvelous community support. And I think especially in the early days of HIV, a lot of individuals would have had a hard time surviving without the support of the AIDS Network.
Yes, I did read a bit about with Michael Fair and them when they did. I think there was 5 of them that got it going, my understanding, and because they were having problems with the province trying to get support for helping out with materials and things like this. So they kind of took that on their own, which I have to say, give them a good pat on the back. So yeah,
absolutely, yes, and the government support was slow to come. Support from the government depended on who was in power. I mean, one of the health ministers, Jim Dinning, received the first, I think it was called the Community Awareness Award from the AIDS Network. But in all the time that I worked for government and ran the sexually transmitted disease program, government support was variable.
Yes. Yeah, since you mentioned Jim Dinning's name, actually, I do have a question that was given to me by Michael Fair that, goes back. So the question that he asked me to ask is what was happening behind closed doors discussions developing the 5-year plan by the Minister of the Department of Community and Occupation, Jim Dinning, that was announced in 1987.
So that's a very difficult question to answer. Yes. There were discussions among, I guess, the politicians, the bureaucrats in the department, that sometimes asked for input from those of us who worked at ground level. Very frequently, they did not ask for our input.
Yes.
They developed this 5-year plan and developed an AIDS program. The AIDS program was run separately from the sexually transmitted disease program, which at the time didn't make much sense to me and still doesn't make much sense. There, it is sexually transmitted. Why is it not part of the same program? Having said that, the AIDS program was run independently of the sexually transmitted disease program and accomplished many things. They were terrific in providing education in schools, education in healthcare workers. I don't know if they were that successful in providing community support.
Okay. Yeah, then it makes me think of another question, going back to the treatment of the patients in the hospital, and that like there were certain protocols that were to be followed, for different types of diseases. This is how we treat them, things like this. And it was where I think you mentioned in one of your interviews that the at that time, the disease itself, HIV, and that was similar to that of hepatitis B, and that those protocols should be the same. So the patients should be not, put into private rooms, things like this. But all those protocols were changed for, somebody with HIV. Was, who made these type of decisions? Any idea or insight?
I'm going to blame the administrators, but the blame is not entirely theirs. There was input from some medical personnel. I have no idea who. I was never part of that discussion. I wasn't invited to be part of that discussion. Infection control individuals in the hospital develop these protocols, are responsible for them. But I think they were very slow in updating protocols to reflect the new disease information.
Yeah. And that's very kind of understanding how things go within, the government, things like this, which I worked for the government for 35 years. So I kind of know that things don't happen overnight. And but even back at the time, I'm just kind of jumping back a bit, all the, people that were diagnosed with HIV and things like this. I mean, they went through so much. I mean, they were losing their jobs. They couldn't be insured. I mean, it was just I mean, I don't know if a lot of them committed suicide. I'm sure that, probably a number of them did because they couldn't handle things. So.
Exactly. It was extremely difficult for patients. As you say, if they disclosed at their workplace, they were at risk of losing their job because individuals in the workplace were not educated. People didn't want to work beside or with someone who was HIV. Some churches were supportive of individuals, some were not. So you took a risk if you disclosed your diagnosis to your clergy. As I said before, many were disowned by family. It was a very depressing time.
Yeah, and also at the beginning, you did go to a lot of their funerals, by my understanding.
I did, and I continued that for the first 6 to 8 years of providing care. And I then realized that I just couldn't continue going to funerals. It took a huge emotional toll for me personally, and I wanted to continue working in the field. So I sadly had to make the decision to stop attending funerals. And I mean, as the epidemic progressed, gratefully, there were less funerals to attend. It was personally very difficult for me.
Yeah. Then also, when you went over to College Plaza and you had your own practice there, were you doing research out of the office there?
I was doing research. And there was some HIV research, but most of it was other sexually transmitted infections.
Mm-hmm. Okay. Can you can you reflect on what was probably one of your biggest challenges over the year?
In the early years, in the mid years, the answer is easy: working for government.
Yes.
A challenge, which is why I left and went into private practice. Maintained my university association, but said goodbye to the government. And if I had not said goodbye to them, they probably would have said goodbye to me, because I was rocking the boat, which you can do for a certain period of time, but not for a long period of time. That probably was my biggest frustration.
Yes. Yeah. Do you still feel that there's still a stigma around with HIV and AIDS?
I do. It's much less than it was. And the stigma now, I think, is a bit different as the risk groups have changed, as the gay community has done a superb job of self-educating, and there's much more public education. But the new big risk group are injection drug users, which face a lot of prejudice with or without HIV, but there are a lot more challenges in providing care for that group than there was or is for providing care for individuals who are much more stable.
Yeah. Okay. Also, I have a question here. It was from Catherine Broomfield. She's the executive director for HIV Edmonton. And that basically it was, what is your perspective on how the field of sexually transmitted and bloodborne infections have developed since 1984?
Oh my. It has changed completely. Our understanding of all the infections that fit in that group have expanded exponentially. We are better at diagnosing, we are better at managing. There is no comparison. 1982 was the medieval ages in comparison to where we are now. We still have a long way to go. We don't have cures for a lot of the infections, but it is day and night.
Yeah. Okay. Also, I have another question that was given from an unknown person, and I'm not asking this for a friend type of thing. The question is, was there any patients or AIDS victims in the past that stand out in your memories today?
There are individuals who stand out because I developed a close relationship to them. I don't mean personally, this is professionally,
Yes.
but
Yes.
it's always a joy to see them. They asked terrific questions. They, by and large, followed the instructions that they were given. But I also remember other patients that were very challenging. So I remember them, but I don't remember them fondly.
Yeah.
But I remember many more individuals on the positive side. I still remember faces. Yes, I did. Have many memories.
Yeah. And okay, I'm running out of a few things here, and that I'm just wondering, is there anything that I haven't covered that you would like to talk about? There's so much out there that you've done over the years, and I've read so many articles that I'm still in a spin.
I think when I remember back to HIV, I remember the struggles we had in the early years, and it was until the early 1990s when the protease inhibitors, this new group of drugs, became available. Those first 6, 8 years were full of challenges. Medical challenges, there didn't appear to be a lot of progress in our ability to manage the disease. The number of patients who succumbed to the infection, the number of individuals who, towards the end of the course of their infection, said, I've had enough. I can't do this anymore. Will you support me and allow me to die with dignity at home? That was tough. It wasn't part of the medical training when I graduated in medical school. But I'm very happy to say that I was able to help many individuals do that, not actively, but passively. And then in the 1990s, there were new challenges. We had better medicine, but with better medicine come more side effects. So one had to manage that. And then in the later years of HIV, we again saw not misinformation, but complacency among risk groups. There are now these good drugs available. If I am HIV positive, someone's going to take care of me. So I don't need to use condoms. I can have 20 partners in a week, and I really don't care. So that was the later challenge.
Okay, so thank you. And just a closing question. What are you doing these days to keep yourself busy?
I have moved to Vancouver, as you know. I got sick of Edmonton winters. I don't care if it rains for 4 months here. If there's snow for 2 days, I stay home and laugh at Vancouverites who can't drive at the best of times, but they certainly can't drive in the snow. I enjoy reading. I enjoy music. I go to a lot of concerts. I have some property on one of the Gulf Islands that I've had for 30 years. I spend a lot of time there, and I'm close to family. All my existing family lives on the West Coast. So there's never a dull moment. It's a beautiful city to walk in. I'm enjoying life.
Okay, great. I thank you very much for all the work that you've done over the years. Many people think very highly of you. And I really thanks again for taking the time to have this conversation with me. Take care.
Thank you, David. It's been a pleasure to see you and participate in this project.
Bye now.